It was probably about 10 years ago when we started to explore the possibility of moving from our previous premises and merging together with a neighbouring practice. In our previous buildings, patients found it difficult to access because wheelchair access was inadequate, doors were too small, rooms were too small, there was no disabled access to the first floor, and also the surgery could not expand its services to provide enough services for patients. So we didn't have designated rooms for minor surgery, and we didn't have enough rooms to be able to get the right sort of clinicians to work in the building. So we were limited in the number of services we could provide. We've never built a building before, so we had to seek advice from those that have, and we worked closely with a developer, Apollo Medical, who have a lot of experience of building primary care facilities.
The scheme appeared to be a replacement for the Lattice Barn and the Woodbridge Road surgeries, but then when we started to talk to the GPs in more detail, we realised they had a far more strategic view about how to deliver services within the region. So we assisted them in pulling together business cases to put to the then PCT, which are now the CCG, to create a sustainable transformation to form a hub regionally.
In a building like this, we now have fully compliant disabled access. We have the right number of rooms for the right number of clinicians. We do have a designated minor ops room. We do have properly appointed nurse treatment rooms. And we have space to be able to expand our services to get other workers to come in. For example, community support workers, mental health link workers, community midwives, drug and alcohol advice workers. One of the things we've always wanted this place to be is not just a resource for ourselves, but for the wider community. So we envisage being able to use our conference facility suite here for health education for patient groups, local charities, the local GP education training scheme, antenatal classes. It will allow us to do all of these things, to be a hub for that sort of education of the public that we could never have done in our previous buildings.
The development of a GP surgery and primary care generally takes a huge amount of input from a lot of different stakeholders, and it requires a specialist to be able to pull all those elements together. There are a huge amount of inputs, there's a lot of compliance which needs to be considered as part of the process. That's why you need a company such as Apollo to be able to pull that together and to create something which is suitable not just for now but can be adaptable and compliant for many, many years in the future. We always look to work in partnership with GP practices. The more they input into the process, the better the outcome. Their input is important to us, and it's not just in terms of the services they input, they service in terms of the architecture, in terms of the interior design, and also the commissioning of art. And at the end of the process, when the GPs who have been part of that process move into the new facility, they then benefit from realising that they've helped to build that up and create this space for themselves.
We spend a lot of time thinking about the reception area, our telephone work, our administration work, so that it's a nice place to come to work. People want to work here and want to stay with us. As far as recruiting clinicians, we wanted it to be a place that would allow clinicians to thrive. For example, the room I'm sitting in now is the room that all our doctors and nurses meet in every day to be able to discuss cases. So all of these things were designed to improve our service, to improve the experience of our staff, which has a knock-on effect to help our patients, which is fundamentally what we're here for.